We're first point of access, so it could come in via a health line, it could come in through a council line, and we deal with each case on its merit. What we try to do is treat everybody as an individual, to keep them in the community, in their own home, as long as possible. We can pool the people in the room together to say, right, this is the scenario we've got, what do we all think we can do or offer to help, what kind of guidance, support can we give?
I basically facilitate access to the third sector service provision. So I work very closely with social care and health professionals. In my case, really my remit is for older people. I do an awful lot of information provision about social groups in the community. I have the ability to be on the telephone almost straight away when I receive referrals and to provide that immediate support as and when they need in the best way possible makes a big difference to their lives.
I assess their need for personal care, meal preparation, help within the home. That's our ethos, is promoting independence, helping somebody live the sort of life they still want to live without being dictated to by their conditions. When I go out and see them, I do a full assessment with them, but it's not always about assessing their needs. It could be something very simple that could make a lot of difference to somebody. For example, I saw a lady in the past year who believed she needed a care package. After sitting with her, going through her needs, she was able to do a lot of things. She'd had one very simple problem that was causing her, the most stress every day. We were able to come up with a small solution which just enabled her to put on shoes and socks properly every day, and we bought a sock puller on her. And following that, she didn't need a package of care at all.
We take quite a variety of calls, so it's mainly district nurse. We also do emergency dental, property and maintenance as well for the hospitals, podiatry. Probably a positive impact that patients get when they phone in. I think especially if we take district nurse, for example, because district nurses' questions and patients can sort of vary on what they're asking. Having one centre that they can phone in, I think makes them feel at ease. I had a patient on the phone, they were querying how to go about getting a commode. Before we had the nurses based here, obviously it would be a case of giving them a number for stools or another number. Now we've got the nurses here, I'm actually able to open a referral, get it over to the nurses who can then contact the patient the same day and arrange delivery of that specific equipment.
We work closely with social services and Age Connect. So if there's anything untoward or if a call handler feels that something needs to be dealt with urgently, they'll pass it over to myself. It means services are delivered quickly to patients and we're freeing up the district nurses to do their job more efficiently. Whether it be a relative ringing, whether it be the hospital ringing or a GP, they're always very grateful that actually we're not passing them from pillar to post. And we are referring onto the right team first time. So sometimes you may get a referral in saying, oh, I'm not sure if this is you, but I need this for my patient. And rather than me or us pass it back and say, no, that's not us, we can say, no, it's not us, but I've passed it on to the right team, and the responses are quicker. We're trying to keep people out of hospitals by liaising with social services. We can sort of expedite their services if we feel that that's needed. So yeah, I think we just provide a much more efficient, faster service. We need to look at the client as a whole, which I think we do here. So we're not just focusing on, oh, they need a dressing, that will be the district nurse. Oh, they need this, that will be social services. Oh, they need help with shopping, that will be Age Connect. We look at the whole picture and we all work together, and there's no sort of duplication then. We're all doing what we should be doing and making it as one referral, and I do think the patient benefits from that. From the thanks that we get from people that make the referrals in, they're saying that the process is so much easier, and they know that if they're not sure or have multiple things going on with a patient, they can just make one referral here and we'll deal with it all.
Naturally, as we've come together here, being based in one place and co-locating, that's made a huge difference to relationships. If you can talk to somebody, I can pop over to somebody's desk literally two minutes away, and we will equally have that returning relationship. So people can come to me any time of the day, I'll go to them, and we'll share individual cases. And sharing, or when you put all that knowledge together, whether that person, you know, healthcare professional here is social care based or whether they're third sector based, it's amazing how much knowledge you can pull together within 5 minutes.